I don't like to do any restorative that's going to require an impression until I've had the teeth in retention for 3 months. The gingiva is always a little puffy after braces. I want that to kind of settle down. And also I want the PDLs to start clamping down around the teeth so they're not as mobile. I don't want a tooth moving in my impression. Now I'm going to have, a bunch of veneers made. I don't want that, okay? I like to have a 3-month retention period before I do any cosmetic dentistry, any indirect cosmetic dentistry, anything that requires an impression.
When we are doing any type of indirect follow-up cosmetic or restorative dentistry, I do not like to place 3x3 fixed retainers. Reason being, it can make the follow-up dentistry more difficult. It'll be much more difficult to prepare and seat a bunch of porcelain veneers if the teeth are splinted together. So instead, we tend to use clear overlay Essix style retainers for that initial 3-month retention period. Here's a case where the patient was congenitally missing 2 upper lateral incisors. We opened up the spaces to allow for implant restorations. We added Pontics to the clear overlay retainer to allow for better retention and aesthetics for the patient during that initial 3-month retention period. Here's a case where we intruded the upper posterior teeth to allow space for lower implant restorations. We wanted to maintain that upper intrusion while waiting for the implants to be placed and restored. We added Pontics to the lower clear overlay retainer to help maintain those upper posterior tooth positions. Another option would have been to place acrylic Pontics in a Halde retainer. In this case, we were aligning and intruding the upper anterior teeth and aligning the gingival margins prior to placing porcelain veneers. This left us with one upper central incisor much shorter than the other. So we added a partial Pontic to that tooth in the clear overlay retainer to allow for better aesthetics during that initial 3-month retention period. After preparing the veneers, we shrink wrap and splint the veneer temps together to give some retention. We will then cut a window in the clear overlay retainer to allow for the longer teeth to come through. After you seat the veneers, you can then make the new final retainer of whatever type you and the patient decide on. To make sure you don't miss any of our Powerprox pointers, please subscribe at 6monthbraces.com/orthotips. To learn more about our live seminars for Powerprox 6-month braces, please visit 6monthbraces.com/live-seminars. To learn more about our unlimited case support and online seminars, please visit 6monthbraces.com/online-seminars. If you prefer to call us, our phone number is 440-646-1000. To learn more about our laboratory services for Powerprox 6-month braces, which include digital bracket placement, 3D printed indirect bracket bonding trays, digital case setups and treatment simulation images so you and your patients can both see the case results before you even start, IPR guides so you know the exact amount and location of any IPR that you may need, and a lot more, please visit 6monthbraces.com/PowerproxLab.